No, it's still connecting. Okay. I try to keep a pleasant face while it's connecting because inevitably it like captures me at the strangest moment. And even if I like try and do it, like the moment I talk, it connects. So undoubtedly my face for this one will be like, and it will look great. You will look great.
Sure.
Well, so anyway, but yeah, so the FACE Act that they're trying to repeal it, but then they used it to arrest Don Lemon. And what's the name of the other woman? Fort is her last name.
Hmm. Yeah.
Mm.
I just really think that they're trying to use the Freedom of Access of Clinic Entrances Act, the FACE Act,
Yeah.
and trying to use it in a way that serves them. But, just last year they were trying to take that away and actually allow protesters to block patients from trying to get into clinics. So I don't know. We'll see. You know, it sways, regulation and policy sways from day to day and how it's going to serve,
Yeah.
the party priorities. So
I mean,
it's always evolving.
it's classic MAGA, like, "Oh, it works for us, we like it. It doesn't work for us, we don't like it." I mean, and this is not the topic of our conversation today, but that goes for the Second Amendment too with Alex Preddy. "Oh, we shouldn't have been carrying a gun, but we can carry a gun." Like, there has to be some semblance of logic to this. We can't just make it up as you go. That's not how a country of law works. Or does it? Anyway, thanks everybody for joining us today. I'm on live with Lauren Kari, who is a dear friend of mine, an incredible advocate for reproductive justice. She also is the author and creator of the Southeast Reproductive Justice and Policy Substack. Subscribe. It's so important for so many reasons, many of which we're going to get into. And one of the things, Lauren, that's so incredible about you is, and unique, I think, in this space of reproductive justice, is that you're really knowledgeable about technology, both in terms of how technology can help women access reproductive care and justice, but also how technology is being leveraged to keep us from receiving that. So I hope we can talk about that as well, because that's really your unique, I think, area of access that or expertise that is so needed and isn't amplified on this platform enough, I think. But also, congratulations. I saw your number 48 rising in health politics. So that was really big. Congratulations.
Yeah, thank you so much. Well, first, thank you so much for having this conversation with me today. For my first Substack Live, I've got to say, I've never felt to be in better hands than with talking with a friend. So, how exciting is that? Um, yeah, I think really the tech portion
Mm.
is there because I want to be forward looking. Right. We know what's going on in educational, but I'm so excited about discussions of building a better, future and healthcare landscape for people to access care in reproductive health. So I'm really excited. I think technology is going to be a really pivotal role. I'm an optimist when it comes to that. And I think there's a lot of organizations and startups with integrity that are entering this space.
That's so exciting to hear, right? Because I mean, rightfully so, a lot of people, and this now we're already off on a tangent, but rightfully so, a lot of people, particularly most recently, Stacey Abrams talks about how technology can reproduce and amplify already existing biases in the medical community. So hopefully, women can, and feminists, regardless of gender, can leverage technology for the opposite. But Lauren, I recently read, and you're writing about how you got started in policy, but I was so touched by it. Like, can you just talk about what led you down this path towards policy and advocacy for reproductive rights?
Yeah, so I have experience really with exposure to system failure. While interning at a free healthcare clinic in Kentucky, I was working alongside physicians different types of providers who volunteered their time at an after hours clinic. And we would hold them in state clinic departments, kind of traveling to meet the needs of where the patients were at. And what I really came to notice is you could treat a patient clinically while they were in front of you and you could help them. But they're going to go back into their environment. And what I was recognizing was a lot of the illnesses and chronic health problems were systems. And
Mhm.
I was very insulated growing up from this. And so this was my really like first experience of the impact of these systems and policies on an individual level. And I was just like, this is incredible that people are in these situations, in these predicaments, can't get health coverage and are, battling a health system. And I wanted to understand, I was thinking go pursuing a clinical side, but I really wanted to understand the administrative side of healthcare and insurance. So I figured I'm going to get a job working at clinics throughout the Appalachia,
Wow.
Eastern Ohio, Eastern Kentucky, Eastern Tennessee. And I traveled to all of the different clinics
Girl,
in
you got to
very
write a
rural.
book. You have to write a book about that. That's memoir right there.
There's some pretty incredible stories. I mean, there were at the time disability clinics that had to have a gun underneath the front desk because people would come in so desperate to get disability that it's a different microcosm of the world. And I love it. I love it. I love the people there. I love the culture there. I love how proud people are. I love how people take care of each other there. And it's just unfortunately an historically exploited region of our country. Um, what really prompted me to get into policy was legislation came out, I would say like 2017, 2018, that prevented physicians from diagnosing Black lung. So in Eastern Kentucky, there's a ton of coal mines. It's the predominant, main way people make money. And it's keeping a lot of these little rural areas afloat, unfortunately. And the policy was that you had to get a certain board certification and certification to legally diagnose Black lung. And what they did is they prevented how many providers in the state could get this certification, and they spread them apart and away from the patient population that needed it. A lot of patients in these areas also lack reliable transportation and don't have the infrastructure for like a bus system
Yeah.
or anything like that. So it was set up to prevent and protect big coal companies from having to disclose the frequency and cases of Black lung and the harm at the public health level that was being created.
Well, and I mean, I just want to just pause for a second because the level of exploitation of Appalachia, I don't think a lot of people understand the depths that it goes to. And I just want to draw one quick connection because it's insane, which is RFK made his mark as an environmentalist, right? With his documentary on mountaintop removal in Appalachia for coal mining. And that documentary also talked about, the prevalence of Black lung within coal miners. And now, right, we know that he did that not to help those people, but to advance his own agenda, which is now preventing those people and the people that you serve in particular from accessing healthcare. And I mean, just like the levels of exploitation of that region is absolutely crushing to think about, and yet not necessarily unique in America, in American politics. It's just, the depravity and the search for profits by the insurance agencies never ceases to amaze me. It's just, is there an end? Is there a bottom to this? No, no, there's not. So you're talking. So really, what I find interesting about what you're saying is basically you discovered that you couldn't treat the condition even within the system that existed, right? Or that
Yeah.
continues to exist.
Yeah. Yeah, no, you're exactly right. And I will say, I think a lot of people in that region are rightfully hesitant about outsiders,
Mm.
and about accepting mutual aid. Culturally, um, it is a tighter knit. And because there have been such a history of exploitation and profits from the lives of these people, there is an immense amount of hesitancy of people who are outside the region. So I love that you pointed that out because yes, I think now we're having those conversations, I think more in the mainstream media about the
Mhm.
systems that we thought were there to support us that really were there profiting in a
Yeah.
lot of different insidious ways. So I really appreciate you bringing that up. Um, and yeah, traveling throughout those regions, I saw Suboxone clinics with, lines wrapped down the street of people waiting for, Suboxone or buprenorphine, because of the opioid epidemic that was so rampant and still is in that area. But it's the policy that I recognize, the policy failures, and I was
Mm.
seeing them all day, every day. And that's what motivated me to want to learn more and get a degree in public health with a concentration in policy. And I knew I wanted to be in DC. I was like, if you're going to make change, I mean, go big.
Yeah, go
um,
big for sure.
yeah. So, in DC, so many of my professors were, people who spoke at UN for health, or, my climate professor was the producer of The Day After Tomorrow and did a lot of work around climate justice. And I mean, just inspired by those conversations and how reproductive health was really, something that was being really heavily researched by a lot of my professors at the time. So that kind of helped get me into that research while I was in undergrad. But I ended up working in government affairs.
Mm.
And so I was meeting with senators and representatives, people within the cabinet, Office of National Coordinator, ONC, which does a lot of the health tech kind of regulatory side of things, and meeting with them on behalf of, public health work and public health advocacy. Um, it really was such an eye opening because I got to meet staffers on a lot of these health committees. I got to form these beautiful
Yeah, but
relationships.
like, tell me, like, were they? Because I think a lot of this is so opaque to everybody. Like, we're like, oh my god, the ACA subsidies are expiring. Let's call our senators. Let's call our congresspeople. Okay, sure, but when we're talking about how policy happens, how policy changes, and how policy is made, like, what was the receptiveness or lack thereof when you're knocking on the doors, when you're talking to staffers? Is one question, but then the other question, right? Like, again, going back to your technology, your really I would say expertise in how technology affects healthcare and reproductive health in particular. Like, we know that a lot of people in Congress and their staffers and the Senate and so on and so forth don't have that kind of expertise. And they kind of have to. Like, how did you navigate that knowledge gap in your own work?
So this is a little bit behind the scenes. We like to say this is, learning how the sausage is made
Yeah, we gotta
on
know.
on the Hill. Is it's a running joke that our country is low key run by a bunch of 20-year-old staffers and interns. And I think once you know that and understanding the
Everybody who's listening
dynamics,
who's 20, go to Washington right now. We need you to run the
go,
country.
run, run like you're on fire. So a lot of these, and the reason why they're so young is because it's long hours
Yeah.
and the pay is not great. So if you wouldn't be able to have a family or, whatever on that
Or
salary.
life.
So
Yeah.
it cost of living. So it really only appeals to people in their earlier age.
Right.
There's a position in a lot of offices called the scheduler. And the scheduler dictates the schedule of the congressperson. And so, really, to get through to your congressperson, it's helpful to have a relationship with the scheduler, or that would be your first point of contact. Some offices do have health policy legislative assistants or LAs.
Mm.
So, you could come in and try and meet with them from that angle, but the scheduler determines the schedule. So, they are, they work really closely with the representative's chief of staff to figure out the priorities of their boss, which is like the representative, their boss's priorities, and they are the gatekeeper to getting onto the schedule. Um, so, navigating the schedulers, it's a lot of networking, but also understanding that at the time when I was doing so much of this work, I was working in a bipartisan capacity.
Yeah.
Like, we were in Operation Warp Speed, where everyone, just about at the federal level, was grateful and touting the vaccines and this science.
Wow.
So I'd like to really point out that it's changed so much during that time.
Yeah.
I think now there's way more polarization than ever before. We obviously saw that in the first Trump presidency. I do have to be very honest, where so much of the polarization is carried out by a few people. I think a
Mm.
lot of times behind the scenes, a lot of people are your typical coworkers, which is, it's crazy to say, because a lot of times you're discussing things that you're morally opposed to.
Mhm.
But I think understanding and working with staffers, at the end of the day, I think people really, you know, want to get legislation that's going to be helpful, to the end goal. Um,
I mean,
so
it's
yeah.
just we're so far from I don't know. I think we're so far from being able to conceptualize a world in which we could work together. But I mean, when we talk about who I love that you say our country is low key run by 20-year-olds, like that's actually there's a lot of hope there, because first of all, we can get some more 20-year-olds to go run our country. That would be great. Second of all, I think young people aren't as calcified as their, parents are necessarily, and that you can have more open conversations. And that, if you're out at the bar and having a drink and a casual conversation, maybe there's a potential for, actual discourse and dialogue there. But, it's incremental. And one of the things that I wanted to ask you about, following up on your comment on insurance agencies and how public policy and health policy is influenced by them, and not for the good of us, but it's Black History Month, and I just wanted to really talk about the maternal mortality crisis among Black mothers in this country, and why it's so bad. And it's not just, right, they can't get access to health care in a hospital setting. It actually goes, unfortunately, deeper than that. And, since we talked just offline, I've been looking into how, the systems have edged out Black midwives that historically provided a lot of that care that's not there anymore. I mean, can you talk about how this is related to what we're seeing sort of nationwide for all populations in terms of not being able to get our healthcare, and when and reproductive justice? And I just want to say, reproductive justice isn't just about the capacity to get an abortion if you want it. It's also about the ability to have a safe and healthy pregnancy and birth. Like, that's the other side of it. So could you just speak a little bit to that? Because I think it's so important for all of us to be educated on.
Yeah, and genuinely, thank you so much for bringing up this topic. I would not have my platform if it wasn't for Black women and Black people in general. I stand on their shoulders. I'm able to do the work that I do because they had so much courage to speak up and take action. Reproductive justice was a term coined in 1994. Loretta Ross was, really big in attributing it. You met my hero, and I love that for you.
I do too.
Um,
I love her. Oh my gosh.
it's so wonderful. She's incredible. Um, but it was a way for them to bring in their lived experience and also the intersection of identity into a framework of justice.
Mm,
And Loretta Ross did a ton of work within Sister Song, which was that organization that really was at the forefront of reproductive justice movement. And it has four pillars: the right to your own human body and control of the future, the human right to have children, the human right to not have children, and the human right to parent the children in a safe environment. And
basic. Why can't we agree on that? Come on, people.
it's the pro-choice and anti-abortion people falling under one category. Who would have thought?
Right.
Um, but I think it's really beautiful that you bring out Black midwives
Yeah.
because they've been so foundational in the United States and especially the South.
Yeah.
Black midwives were the cornerstone of care for a long time, a very long time, before obstetrics was even a formal medical specialty. Black midwives would attend, you know, help with prenatal care, help with postpartum care, help with childbirth. They were trusted members in their community, and they would learn through apprenticeships and through lived experiences. They were able to give culturally competent care because these people were in their community. They knew them, they knew their unique situation, the finances, and they could tailor that care
Yeah.
to their patients.
Mm,
And what happened is in the late 1800s, early 1900s, we saw childbirth becoming increasingly more medicalized.
mhm.
And white male physicians, because women couldn't go to med school, led these efforts to professionalize obstetrics and regulate midwifery. So, licensing laws were again leveraged to keep midwives out from practicing. Not only did they face, if they wanted to try and get a license, they were segregated. There was no
Mm,
programs for them to go to. There were no training programs or exams that they could go to because they were Black and because of cost and geography. They really set up a ton of barriers to prevent Black midwives from continuing their care. So when this care group was no longer able to, meet with their patients, it just created a ripple effect that we still feel in the country and region today.
yeah.
Um, a lot of people lacked maternal care access. They didn't have obstetrics in every county.
Well, and also imagine you're a Black woman in, 1907 and you're having a difficult pregnancy and you go to the hospital. Do you think you're going to be seen? No, absolutely not. They're not going to see you because it's segregated. So, I mean, it's just it's in the levels of, as you said, ripple effects. It's like, okay, this was a generational power. This was a generational form of income, right? And probably a pretty good income, all things considered. A way to keep community bonds, across class in Black communities, and to disassemble that is an assault on not just women, although women in particular, but in communities in general. And the other thing is, so much now we are seeing in reproductive justice is that we're having as women to create um do it yourself, right? Systems. So I know a lot of women are creating period pantries to provide women who can't afford it with period care. I stockpile, Plan B in case someone needs it and we can't get it. I can pop it in the mail for them. I'm probably not supposed to say that, but ever. Sue me. Um, and it's right, like, if we had the opportunity to build on and learn from these, communities of self-sufficiency, we would be so much further along, and we're really having to reinvent them in a lot of ways, but, I love that you bring up Sister Song and Loretta Ross and the women who came before because, as a women's historian, I'm always looking at the past and just being shocked that, like, "Oh, women did it before. We could just do that again and update it to where we are now. We don't have to reinvent the wheel." And I won't go on my history. I won't go on my history tangent. But, you work in the Southeast. Are you seeing new communities of Black midwives coming together or midwives, period, regardless of race, um, to provide healthcare and reproductive care where that is lacking, right? Because, and then I'll stop talking, but one thing that really freaks me out is that so many of these healthcare clinics are closing in rural areas. And where are women going to go? I mean, where literally, if you're having, if your water breaks and you're having an emergency birth or you're having a problem, you can't drive for 4 hours. Where are you going to go?
Yeah. Um, a few things that I just wanna underscore is I can't emphasize enough that Black women and Black gay people have been doing so much work consistently for a long time, and when Dobbs came out, I think more attention came to it, but Black people have been doing this work and
Yeah.
they've been built creating these networks. And I think now it's hitting so many people in different economic statuses and we're all kind of waking up. I mean, Black people have been saying this for a long time and been, kind of the canaries in the coal mine of their historical treatment and how that can be impacted across class that no one's really protected. Um, but I really love that you're talking about this. I think we're seeing systems failures across the board. Public health, HHS. We're seeing all of these systems that, let's be honest, we're exclusionary. We're letting people through the cracks. Weren't
Yeah, they were
serving
barely
everyone.
functioning before, right? They wasn't like we
Yes.
had utopia. We had like a barely functioning system that maybe if you had an emergency, you could get some care, hopefully, maybe. But no, it was not like they took a sledgehammer to an existent sort of perfect structure.
Yeah, it was archaic, and we just kept adding on regulatory addendums or, um, you know, funding bills to kind of like help it hop along. Um, but I have to emphasize that I do see what you see with that return to more community care and community resilience. And, a lot of what's happening is a lot of these abortion funds and Black organizations that started, as abortion funds are now coming together and coordinating resources and efforts in a newer way. I know that there's in Alabama, for example, there's a new coalition that has like Yellowhammer Fund and a handful of other really incredible organizations trying to move the needle with reproductive justice policy and access. And they're all coming together to address postpartum care. So addressing people in their everyday life who are given care and need a community. They're addressing advocacy initiatives. They're coordinating even things like transportation to appointments, to medical appointments. Um, you're seeing just a lot more on the ground work coming together in not so loud ways. A lot of this is coordinated on a person to person level and then just kind of builds like a network.
Mm,
So we're seeing a lot more community based efforts, but I've got to say, I'm noticing a lot more younger people getting involved. Um, and that's been such a joy to see.
mm,
Um, Unfortunately, they're inheriting a tough system. And I love that they are getting more active. I mean, as a millennial, our generation never considered getting involved in politics, like in our teens or early 20s, even. Um, and I
yeah.
love seeing that.
I mean, like we have indivisible protests here every week, and it's usually these lovely boomers who are, they protested the Vietnam War and that was awesome. And they're out there, they were tired. They've got their t-shirts on, they're waving the flags and holding up their signs. And it's great. And I'm like, thanks, boomers. I've got kids. I got to work. I can't be out there with you. I'm so grateful. But this last Saturday, I was driving home from the farmer's market with my kids, and they were just lined up on either side of the street, and the majority of the people out there were teenagers. I mean, my jaw just dropped. And, this
Love that.
yeah, I love that. I mean, I think they're seeing two things in my mind. One is that, right, the system that existed is failing them, but two, that the people who built that system aren't that smart, and they could do a better job, with the skill set and knowledge that they have right now. They don't need to wait for permission. You don't have to ask how to do something. Just do it and figure it out while you're learning. You'll make mistakes, but so do, everyone else. And I think having the most incompetent white males in the world in charge of the world's biggest superpower and economy is really proving my point that, they're idiots and that you could do a better job for sure as a high school junior, better president, 100%. So I think they're waking up to that, or at least I hope they are, because it's that future. But then the other thing is, like you said, millennials usually didn't want to get involved in politics, and I agree, because in one way, it wasn't so clear that it was like this. There was still that veil of like, oh, it's
Yeah.
complex. Only an expert could do this.
Yes.
That veil is totally gone now. It's totally
Yeah.
gone.
Yeah. I think, and that's largely why I wanted to start my Substack is
Mhm.
I knew if I was, you know, when Dobbs overturned, I had done a ton of work with, health tech and HIPAA and protecting data. And I felt like, you know what? I might as well take this frustration and do something with it. I think I might lose my mind if I just, have nowhere for that energy to go. And
Absolutely.
so I, before I got into this work, I recognized how it feels how complicated policy and regulation and these systems are. And they are by design. There's a reason they are. And I felt, I understand these systems. What if I could translate it to people? And what if I could give them context about the South? I think I hope that my Substack does read like a love letter to the South
It does.
because
It does. It absolutely
um,
does. And I love the South too. It's like not popular to say, but there are so many wonderful traditions and people and histories in the South. Like the first interracial union was in the South, and among sharecroppers. Like there is that legacy of social justice, and wonderful storytelling that comes from the South that's so often forgotten, and also attacked. And I wonder if that's not part of the reason why the South is so under attack, is because that's where a lot of our strength as Americans actually does come from, is the struggles that have been overcome in that region. I mean, that's a little bit esoteric for conversation.
But it's not, they wouldn't want to be banning books and
Yeah,
banning, Black history if that wasn't the case. And I
yeah,
think it really is hand in hand with, we've got such a complex history. It's so heartbreaking and sad, and
yeah.
reckoning that with where we're going and where I I think the South really is misunderstood, is we're just a historically oppressed region,
Mhm.
be it gerrymandering. And, I'm happy to talk about how the South got to be correlated with such regressive reproductive policy. But I think really the undertone is we've always been heavily gerrymandered. We've always had so many of the odds and the corruption stacked against us. And I think now a lot more people are just aware of it. And of course, we've got our share of very, 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 very far right. Like, I'm not naive. I'm not going
Of
to,
course, of
say
course.
it's a systems thing entirely. But I think that exploitation by design to keep us separated,
Mhm.
is definitely something I think we're all noticing.
Oh, yeah, and it's absolutely, and it's always been in service of, right, the oligarchical class, whether that was, slave owners in, pre-Civil War America, or, the, Elon Musks and Jeff Bezos of today. But I do, you mentioned that the South is under attack, and it is a historically oppressed population. And, I think evidence of that, in case in point, is these crisis pregnancy centers, which I didn't know about as someone living in California. I guess we have them here, but they're such anomalies, that I didn't realize how insidious they are. And yet they are so widespread in the South. And they are, I'll let you speak more specifically, but in my mind, it's like these places are really there to try and take the lives of women, either physically or in terms of their capacity to dictate their own futures. But like, what are these places, and that, and crisis pregnancy center? That sounds nice, right? Like that. Oh, oops, I'm pregnant. It's a crisis. Help me out. But that's not really what they are.
Yeah. So, pro-choice organizations, refer to them as crisis pregnancy centers. A lot of these centers have names that have the word choice in them. Women's Choice Clinic. So it is very insidious because you don't know, you know,
Right. I want a
who's
choice.
who.
Choice is good.
Exactly. Exactly. And they do that by design, right? Because if you have choice in the title, perhaps that means that you could get medical care if you were seeking an abortion. So what these crisis pregnancy centers are, or CPCs, are usually faith-based nonprofits, and they are not medical providers. I have to stress that they do not have any board certified clinicians that are on site. They don't hold any, qualifications to run like a medical clinic. Um, I really have to stress that there's no licensed healthcare facilities that are crisis pregnancy centers. Yet, when a patient walks into the waiting room, everyone's wearing scrubs. It looks almost like an actual medical clinic. A lot of the things that you would expect to see,
Yeah.
a waiting room, a front desk personnel, all those kind of things. You have different rooms that patients go into. And so it is very predatory in that nature.
I mean, I
And
wanna pause and say, if nothing else, I am incredibly impressed with the performativity and capacity of these people to storytell. I mean, can you imagine, right? This is such an elaborate staging. You get a building, you build it out to look like a medical center. You cast the staff, you costume them as if it were a medical center. I mean, the layers, right? Can we just send these people to New York and give them internships in Broadway and like redirect their energies to something good rather than oppressing women? Like, can we do that? Because I mean, by itself, the levels of deceit are are im shocking, despicable, and impressive. And where do they get their money? Where are these people getting? Because this it's you don't just set up one of these, like, overnight on a shoestring budget. This is money. This is serious cash to set this up. Where's the funding coming from?
Yes. So their funding predominantly is coming from private donors and also churches. I have to say that have been, looking at CPCs for a very long time. I know Missouri had a tax credit of 70% off if you donated to crisis pregnancy centers. Um, Autonomy News, shout out to them, last week uncovered a story where one of these crisis pregnancy centers in Georgia, was actually receiving like federal funding for it through HUD, Housing and Urban Development Programs. And it went under the radar for a very long time. In Florida, I believe the stat now is that 20 to 30 million dollars of taxpayer money goes to these facilities. And it's been one of the biggest mechanisms that the anti-abortion organizations have been using to convince women to keep their pregnancy. I have to say that what's when it comes to predatory is when you go into your appointment, generally it's people who just found out they're pregnant.
Mm,
And, they're looking to establish care, looking to learn more about their options, or looking to have an abortion.
right.
And what they will end up doing is, you walk in, you give people your ID, your information, and they have access to that data because they're not a health facility, they're not licensed. Who knows what they're doing with your data? A lot of speculation around creating a database of people who are or were pregnant being created. That's really insidious side of things.
I mean, this
And
is just like pure dystopian psycho-ness. I mean, I think it's really I'm so grateful to you and other people who are doing this work, but it's hard to believe that in 2026 in the United States of America, that a woman would be duped into receiving, uh, uh not receiving, duped into thinking she was going to receive health care, contrary, but convinced that she received care contrary to her wishes, but in the process of being duped, that she would also have her information gathered. And that, let's just be honest, they're probably then going to track her pregnancy. And if her pregnancy doesn't come to term, we are seeing now that states are prosecuting women for not carrying their pregnancy to term, even if that pregnancy, right, is aborted legally in another state or by legal methods. I mean, this is um, like straight panopticon scenarios. And one of the things that, again, I think that this thread has gone through our whole conversation, right? Like, Black people have understood what fascism in America is because they've
yeah,
lived in fascism in America since they were kidnapped and brought here, right? Like, and now we're getting it. Okay. Now women in the South are being oppressed and targeted by these anti-women, anti-health, anti-pregnancy groups. And but we see now, right before I could say, well, I live in California, I don't have to worry about what's going in Alabama, but that's not the case, right? Like when this is a s- this is the first front. It's not the
yes.
last front. So how are we seeing these policies being exported to, blue wall states? Like, what are you seeing as the first incursions of these policies being implemented and engineered and perfected in the South being exported? Um, beyond right the fall of Roe. Like, what else is happening that's raising your alarm bells in terms of nationalizing anti-woman policies?
Yeah, no, that's a really good question. I think the South is ground zero for a
Yeah.
lot of this restrictive policy. And I think there's 3 things I'd really love to talk about
Mm.
is the Texas legislation that allows prosecution for OB-GYNs and could fine them up to $100,000 or jail time. We're seeing that those bills now show up in different state houses. We have it in Indiana and which is not the South, but Indiana and Florida for sure, but a lot of legislation in other, states trying to enact policies like that. I also want to highlight a Texas Supreme Court case. I
Mm.
believe it's Pearl versus HHS. And what that did last year when it passed was it prevented reproductive health care from falling under HIPAA. So reproductive health care
I'm
data,
sorry, what?
yeah. And it is a federal court, so it has standing in the nation. So the issue is, you know, people who receive this care, even if they go to a legitimate health facility, your data is not protected. Even if you're in California, even if you're, in like California has a lot of the strictest tech regulations in the nation.
Okay, so wait, let me break this down. If I go to get an abortion, my data might not be protected under HIPAA. That data could be shared out by the healthcare provider, or whomever, with any government agency that asks for it.
Yeah, an attorney general or inspector general could theoretically get access to all of that health information and that data. We don't have centralized places of information. So it would be inhibitory for them to access that information. But yeah, that's a very real thing. And we're seeing Indiana leverage that Texas SCOTUS opinion and precedent in their state houses. They're looking at getting the AG, Attorney General, involved. So, what I really want people to know is it's so easy to write off, okay, what's happening in Minnesota? That's Minnesota. That's not my problem. What's
Right.
happening in the South? Well, that's not my problem. I don't live in the South. But I think the issue is these injustices don't abide by borders.
Mhm.
And so when someone else's rights are infringed upon, your rights are infringed upon. And that's what I really am hoping to use my platform to discuss, build community, build education. Um, and then I was going to talk about the third thing. The last thing
Mm.
is, they're now coming for Comstock Act,
Yeah.
which is allowing medication abortion or contraceptives to be mailed using the US Postal Service or even common carriers.
Right, so
I
like
mean,
FedEx, UPS, DHL, if you will.
correct. I mean, and think about ways of going about surveying that, how all the rights that would be infringed upon. But, that inhibits people in rural California. That inhibits people in rural Massachusetts from getting care who also don't have transportation or, what have you.
Yeah.
So I really hope that people are paying attention to what's happening in the South because it's probably not going to just stay in the South.
Right, and I think, to say when the rights of one are threatened, all of our rights are threatened, that can be kind of an, um, just existential or non-grounded statement. But if you add the clause, because when fascists threaten the rights of others, their intent is to figure out how to take away everyone's rights, then we really understand that the concretization of why it's important to stand up for each other. Because, right, like I often see this. I read this really great, I forget the name of it. It's this graphic novel about um, Cuba when Castro first came to power, and the person who wrote it was a lesbian, and she experienced this, and she was sent off to a work camp, right, because she was gay, and that they were attacking the LGBTQ plus community among other marginalized peoples, but that's because they're on the margins, right? They're on the front lines, and once those fall, then they go to the next circle, the next circle, the next circle, the next circle, and we're really seeing that play out in real time. And I think for women, right, this is a more rapid um, reality than it is necessarily for a lot of men, and particularly white men, because we're seeing the implications, And there was recently that woman, I believe, oh gosh, I can't remember, in Oklahoma, maybe where she had a non-viable pregnancy. They had to take her blood every day to see if she was septic. To be transported across state lines was $25,000. She was, they're middle class, but they're not by no means wealthy. You can't just write a check for $25,000. Uh, and so she was a, middle class white woman. Like, this is affecting all of us. And and just side note, there's this like scene in Downton Abbey when I think Sybil is, like, having her baby. Sybil dies in childbirth, spoiler alert, but, it's a difficult childbirth, but then she, like, gives birth, and the men outside are like, "Oh, women make a big deal out of it, but in the end, it's not so hard," or whatever, and they just don't understand, like, it's this very clear understanding that they don't understand the risks and challenges and pain and bravery and fortitude of childbirth. And of course, then Sybil dies of sepsis, I think. And, we're seeing that these people who are making these laws don't understand that childbirth is really dangerous. It doesn't just like magically happen, right? And just a side note, and then I'll stop talking, but like both of my childbirths, particularly my first one, were emergent. My first one was an emergency C-section. Like, if I didn't have the best care, both my child and I would absolutely be dead. Just dead. No questions asked. But because I did have that great care, we were both healthy. We're both here. We have no medical problems whatsoever, but it's not because of the miracle of childbirth that I gave birth in a, pool in, 2 hours, and it was playing Yanni or whatever. It was because I went through 10 hours of arduous induced labor followed by an emergency C-section by one of the best OBGYNs in the country. Like, thank God. So
Yeah.
anyway, that's neither here nor there, or I guess it is exactly where we are. But
Yeah.
the opportunity for survival, and being able to thrive even after and during childbirth is being taken away from women in every single class of every single color. And that's not a reality from which we can be shielded with money. Like, not even money can transport you to a state immediately, if you have an emergency and you do not have highly trained OB staff when you're pregnant. Anyway, I
Yeah.
guess I've gone on a tangent. Um, but you know
No,
what?
but you're right.
Right.
There's no safeguards.
There's no safeguards.
Yeah.
So of course I'm absolutely grateful for your work. And we're running out of time because I just got up on a grandstand there. But I do
No.
want to ask you, what can people do, whether you're in the South or the North or the East or the West or wherever you are? What can we do to, build community and recognize where we are and take care of each other in that space while also building systems that can carry forward through the future?
Yeah. Well, first of all, I would love an hour of us doing Substack Live where I get to listen to you speak because, I mean, truly, I appreciate you, telling about your birthing story because that's terrifying. And I think
Oh my
a
God.
lot of women are now opting out because it is being taken for granted and it's now viewed in, pronatalist ways. And so I think you beautifully said the risk. It's massive. It I heard someone describe, I've never been pregnant and I don't have children, but someone said it's like you get in a car accident and become a CEO in the same day. And I was like, I love that. I That's incredible.
That's
Um,
perfect.
but yeah, I can't stress this enough. Don't crash out. There are
Yeah.
so many people who are on social media posting a lot of upsetting content, and there is an abundance of that. It's important to be educated. Tune in, see what's going on, get off the apps. Like, once you're informed, I don't think you need to hear 30 takes about how, reproductive health is killing people. Be informed, know what's going on, but transmute that anxiety into action.
Yeah.
If you're in a blue state, call your governor or call your state representative to get enhanced shield laws so that OB-GYNs in blue states can continue to safely mail mifepristone, misoprostol to people in the South. Continue to,
Yeah.
work on that. We're coming up, I mean, I think today was the first day of midterms. I think we're seeing New Jersey have some sort of a primary today. I need to look
I
into
think
that.
Illinois too is having early voting.
Every seat in the House and 33 seats in the Senate are up. We have so much room to get these candidates that are pro choice
Yeah.
into positions of power where they can, put the ERA officially in the Constitution, where they can put, a new enhanced version of Roe v. Wade into the Constitution or into a legal precedent, and create a system of accountability. So we have such a big place for opportunity right now. Look at candidates. Make sure you're registered to vote. Make sure you're eligible, make sure everything is good to go so you don't miss out on any primaries or any voting dates. And also fund a local abortion fund.
Mhm.
Send some money because they're covering the costs of getting women to Virginia from Mississippi. And working out the logistics and coordination. And these organizations are not just getting people to and from care, saving lives, giving people a quality of life, but they're also in state courthouses.
Mhm.
And a lot of these organizations are not taking in any money. All of the money is using explicitly to help people. So funding the Palmetto State Abortion Fund, the Lilith Fund, Yellowhammer, ARC Southeast. I mean, there are no bottomless options. They're all incredible organizations doing the work. And I think too, talking to the guys in your life,
Yeah.
getting them involved in this conversation as well is going to be incredibly helpful. We need more people in the cause.
Yeah, and I think that last point's really important. Of course, my most recent book is about Jeanette Rankin, who was instrumental in getting suffrage through in multiple states. And right, like we need to understand,
Yes.
feminists and women activists, that we need to reach out to men and then make them understand that enfranchising us with our rights is helpful to them, right? It's not a zero-sum game
Yes.
as the powers that people in power would have us believe. The more power, the more freedoms that you help us to gain, the more freedom, the more power you have, right? I mean, and
Yeah.
that's a lesson of solidarity. And unfortunately, women have always been on the forefront of that sort of educational campaign, and Black women have been right at the front of that movement. Always, I will always reference uh, Frances Harper's wonderful speech where she said, "We are all bound up together." At the 1866 suffragist conference. And
Yeah.
that is more true now than ever, or perhaps we are finally realizing just how true that has always been.
Yeah.
Well, thank you so much, Lauren, for coming on, and tell everybody where we can find you, how to subscribe, and just anything else where we can get in touch and engage.
Yeah, thank you so much for having me today. It's honestly such a treat whenever I get to really deep dive into reproductive justice, especially with a friend. It just makes
Mm.
it that much more enjoyable. People can go ahead and find me on Southeast Repro Justice. That's my Substack. I'm also on Blue Sky at Lauren Kari, Kahre. I'm pretty active on both platforms. And that's how people can stay up to date on what I'm writing and thinking about.
Wonderful. And just so everybody, please subscribe. Her work is so important. Your work is so important, Lauren.
Thank
I'm just
you.
so grateful for you. All right.
Thank
Thanks
you.
everybody for joining. We'll see you next time.
Bye.
Bye.